I just want to bring up another point about testing kits before we move on. It's just that because we've been under testing in the United States,
Yep.
or not able to test as many people as need to be tested, is that the numbers of confirmed cases seem to be a lot less than probably what we have. And the ramifications on public behavior, because the curve is spiking like crazy, given the tests that we have completed, the number of cases is rising exponentially. So getting the public's attention in the thing where we're also not confirming cases at a rate that as a health official are out there. This is exasperating a lot of communication problems.
Yeah, absolutely. I mean, you can take the number of COVID-19 positive tested patients and multiply that by some factor of 20 to 50 infected,
Wow.
So if you say there's 30,000 people here infected or 20,000 people in this state, or if you say there's 200,000 people in the United States, multiply that by a bigger number.
Yeah.
And that's probably how many true cases there might be out there.
Yeah, and this is and I don't want to belabor the point, but this is the challenge about social media in these days and just news organizations and health organizations to get that out about how serious it is. If you look at the data, that's one thing, but I think what you're saying is so powerful in terms of that it's somewhat chilling in the fact that we've tested who we've tested, they've come back positive. The factor of people who are untested that you can just project with science and math that are infected is exponentially higher.
Orders of magnitude larger, yep.
So we need to be sheltering and doing things, because if we really had some magic wand and we could test everybody right now, we would be blown away by how many people have COVID-19. Is that a fair statement?
Yeah, absolutely. I mean, could that be 800,000 people in this state, 500,000 people in this state, a state of 10 million people?
Yeah. You're just talking about Michigan.
I'm talking about the state of Michigan where I live. But yeah, I mean, but then you magnify that across the whole country, right? 330 million people.
Yeah, we're talking 20, 30 million people.
It could be that, yeah.
Well, it's chilling, but it's also it's an opportunity. So there is hope. We can all continue to be vigilant about sheltering in place and minimizing our contact with people. Absolutely.
Cleaning surfaces. Might be prudent to wear gloves when you're handling an Amazon box or things of that nature. I think
we just started spraying at home with disinfectant, just spraying with the antibacterial packages, our mail.
Yeah, soap, water, I think bleach and dilution, not mixed with other cleaners, is probably a good idea. Hydrogen peroxide works well. Vinegar, we think, doesn't work as well to disinfect coronavirus surfaces.
Okay.
Just throwing that out there.
This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.